Vamos a empezar la noche de hoy. Gracias a todos los presentes. Y nos es un honor el invitado que tenemos hoy. Voy a comenzar a hablar en inglés para que el doctor Satya comprenda todo lo que estamos platicando. So, welcome, Dr. Satya. We are very pleased to have you here with us at AMEV. And before we begin, I would like to share a bit about your background. So, Dr. Sathya is a physician with certifications in public health and lifestyle medicine. He also holds diplomas in athlete population research, athlete statistics, and human resource management. He worked for the United Nations Population Fund and has over 20 years of experience in academia, government, and non-governmental organizations. His special interests include refugee health, sexual and reproductive health, and strengthening health systems, particularly in fragile contexts. So, welcome, Dr. Sadia.
Thank you so much, Sari. Warm greetings. So first of all, thank you so much, Mariana, Sari, for having me here to share some thoughts and ideas with the Mexican College of Lifestyle Medicine. And all of you having deep interest in lifestyle medicine. I really see this as a great opportunity to have some exchange with you. Of course, share some experience and also learn from your experience, because it's a journey that we embark on in lifestyle medicine as we continue to learn as we go on. But I also want to recognize Victor Sadia, who's not able to participate today, who became an instant friend when we met together in a lifestyle medicine conclave in Doha last year. So when I actually made a similar presentation to the audience there. So once again, in absentia, I want to thank Victor for availing this opportunity first. So again, thanks so much, Sari, for introducing who I am. But just also from my side, I just want to introduce myself that I work for the United Nations Population Fund. That's my day job. So, and my night job is in lifestyle medicine. So it's fitting that here in New York, in the night hours, I'm happy to speak to you about lifestyle medicine. But just a little bit about the organization that I work for itself, the United Nations Population Fund has its central mandate around gender equality. And it is guided by what we call as the 3 zeros. So we aspire for a world where there are 0 maternal deaths, 0 unmet need for contraception, and 0 gender-based violence and harmful practice. So in a way, my interest surrounds women's health, and in gender equality is where my core expertise lies in. So therefore, it is not surprising that this topic that I'm going to talk to you about is also about engendering lifestyle medicine, a public health imperative, and on an explorative journey of the importance of lifestyle medicine, focusing on women's health and discovering the fundamental principles and strategies to prioritize wellness. As a disclaimer, so no man can ever say that we understand what women go through. So we can only try to understand based on our learnings and experience, discussing with our colleagues and with sometimes as a medical professional with patients and so on. So again, no man can be a true feminist, but can be a pro-feminist. So I really consider myself to be a pro-feminist. So speaking for the voiceless women and girls in particular from many parts of the world. So with that little background, if we can have the next slide, Mariana. So the objectives of this presentation, which will last about 20 to 30 minutes, is to describe the social and the biological factors that intersect with lifestyle, and more specifically from the paradigm of women, and to discuss the role of lifestyle medicine in the life cycle approach to health. And then we will also touch upon examining the potential for lifestyle medicine to promote the health and well-being of women and girls. So that's basically the gist of the presentation. So next slide, please. So, of course, and as I said, so this is a work that I actually do more on a voluntary basis for lifestyle. and promoting lifestyle medicine globally. And I have no financial or non-financial interest, which will be reflected in this presentation. And I will not be discussing any unlabeled or unapproved drugs as part of this presentation. Next one. First, the key headlines of this topic that we are discussing. So it's an undisputed fact that women are the bedrock of economies and communities worldwide. The 4 billion women worldwide give birth to 140 million children annually. They are the primary caregivers in families and communities, and they constitute most older people worldwide. Sometimes this is what we call as the feminization of old age. And mind you, there is also the feminization of poverty. You see a number of women in the age group of 80s and 90s, because women biologically live longer than men. In a society where there is rapid aging, you also see a significant number of women in that age group who are also single and who also do not have the economic freedom in many instances. Just to keep it in mind, the society that we live in as of today. Rightly considered the social fabric that holds societies together, women have not been accorded the proper priority within traditional healthcare systems. And this is a global phenomenon. And this is reflected in the fact that women spend 25% more time in poor health than men. So just because women live biologically longer, it doesn't mean that they have a better quality of life and live a better healthy life than men. So they just live longer, but not necessarily a healthy life. One of the manifestations of gender bias that prevails in healthcare is the fact that chronic diseases have remained a neglected topic in women's health life course. A recent Lancet Commission on Women and Cardiovascular Disease estimated that there were 275 million cases of cardiovascular disease in women in 2019. And cardiovascular disease was the leading cause of mortality for women, estimated to be 35% of the total deaths of women in that particular year. As the foundation of health and wellness, now is really the best time to engender lifestyle medicine by recognizing and addressing chronic medical conditions faced by women through research, education, and advocacy. Because improving women's health not only improves overall population health, but has the potential to boost the global economy by $1 trillion annually by 2040, according to a recent McKinsey report, which was released in Davos last year, and again was reiterated in the World Economic Forum this year in Davos. It's a telling publication, a very simple, short publication. I would also encourage you to read that report if possible, which really makes a strong economic case for investing in women's health. Next one, please. Non-communicable diseases are the #1 cause of mortality in women worldwide, make no mistake. And they're responsible for 75% of the deaths in 2019. More than 50% of the deaths were attributed to two non-communicable diseases, cardiovascular disease and cancers. So other contributors, of course, include chronic respiratory disease, respiratory infections, diabetes, chronic kidney disease, and neurological conditions, which together account for about 25% of deaths in women. So if you look at the bar graph on the right side, again, you will see very clearly the leading cause of disability adjusted life years for women is cardiovascular disease, which is responsible for about 14% of the lost years of total health, and cancer about 9%. Given that the global population is living longer, as I mentioned earlier, non-communicable diseases are and will continue to be among the biggest threats to women's health for the foreseeable future. Again, cardiovascular disease is the most common cause of death in all 5 socioeconomic regions of the world, namely the least developed countries, the low-income countries, the lower upper middle income countries, and high income countries. So it doesn't matter where you live in the world, cardiovascular disease still remains as the most common cause of death among women. But at the same time, cancers rank second in all but the lowest income countries, where maternal causes of mortality in women still seems to be highly ranked. So, but cancers rank the 5th in those countries, which are really at the lowest income. But non-communicable diseases, particularly cardiovascular diseases, clearly ranks as the number one in all socioeconomic regions. I want to quote Cheryl Carcel in their recent perspective on women's health and non-communicable diseases in Nature Medicine. They said risks for non-communicable diseases, these conditions, exist at each stage of women's lives. But recognition of the unique needs of women for the prevention and management of non-communicable diseases is relatively recent and still emerging. So it is not an advanced science when it comes to managing women's health by traditional systems of medicine. But we look at some of the reasons for it and some of the defining aspects as to how we can categorically say that women's health has not been prioritized in traditional systems. Next slide, please. There are 6 English words that clearly define the neglect of women's health in traditional healthcare systems. See, 1, women's health has been continuously undervalued in traditional healthcare systems. And what do we mean by that? So men and women have biological differences at the molecular and the cellular level. The science of medicine has failed to consider the impact of sex on the prevention, diagnosis, and treatment of disease. As a result, we do not always have a complete understanding of how medications and treatments work on women's bodies. So this is the undervalue aspect of women's health in traditional healthcare systems. But they're also undermined. Still prevalent today, gender bias negatively affects women's experiences interacting with the healthcare system and receiving adequate care. A survey conducted in early 2019 by the magazine Today found that more than 1/2 of women in the United States of America, compared with 1/3 of men, believe gender discrimination in patient care is a serious problem. 1 in 5 women say that they felt that the healthcare provider has either ignored or dismissed their symptoms, and 17% say they feel they have been treated differently because of their gender, compared with 14% and 6% of men respectively. Thirdly, women's ill health in particular has also been underestimated in the traditional healthcare systems, because the healthcare systems and providers have been short-sighted, viewing women as those with predominant reproductive functions, and hence focusing on reproductive concerns only. Chronic diseases have traditionally been seen as male diseases, and the burden of non-communicable diseases in women has been largely ignored. Next slide, please. Again, if you speak to researchers worldwide, you will also, and looking at the data that is published from many of the research bodies, you will also see that women's health in general has been under-researched. Even today, women constitute less than 50% of clinical trial participants. So healthcare and life sciences research is heavily tailored to the male body. In addition, women, especially those in childbearing years, are often excluded from clinical trial for many years. And just because science, kind of feels that we need to protect women, and rightly so, and their fetuses from potential adverse effects. But it's also the responsibility of science to find a work around it. And the fact that many of the treatments and medications have not been tried in women, but they come to the market, and often you find side effects after they have been released, and women tend to be prescribed such medications and treatments. Researchers have also felt that they could not adequately control women's variable hormonal status, leaving them out of studies. In fact, I was speaking to a lab researcher once who said in many of the experiments that they do with rats and mice in the lab, they often prefer to use male rats and mice, simply because of the fact that the hormonal status of the female mice or the rats cannot be controlled. So at all levels, you would see many of the research on the medications and the treatments that we get have all been tried only on men, or in this case, male animals. We also know that in many instances, the health conditions that the women face are often underdiagnosed. So this is because, example is heart disease and specifically heart attacks, even though we know appear differently in women. But make no mistake, but chest pain still remains as the most common presenting symptom. but it's also been evidence proven that women have more likely than men to experience shortness of breath, nausea, vomiting, or back or jaw pain when having a heart attack. But research again shows that when women present with these symptoms, they face longer wait times in emergency departments, are less likely to be admitted to the hospital, receive less thorough evaluations, and are less likely to be administered tests to detect cardiac problems. Despite, just to give you an example of one particular condition, despite costing the UK economy about $8.2 billion annually, 8.2 billion pounds annually, being the second most common gynecological condition in the UK, affecting 1 in 10 women in the UK, it still takes a shocking average of 7.5 years to get diagnosed with endometriosis, a common condition, but often is not diagnosed because many clinicians tend to kind of, neglect the symptoms in women as more psychological, or to say these are period related, and often do not see them as morbidity. And and that's where you see the underdiagnosis as a global phenomenon. But once you're underdiagnosed, you're also undertreated. And that's why, again, many studies have shown that women's perception of gender bias in healthcare are indeed correct. Compared with male patients, women who present with the same conditions may not receive the same evidence-based care. And this particularly applies in cardiac care and pain management. Women may even get different treatments, leading to poorer outcomes. So this is what, traditional medicine has continued to teach us as lifestyle medicine practitioners. So we should be able to pick the mistakes that traditional medicine has done and continues to do, and make sure that as an evolving science, lifestyle medicine not repeat the same mistakes as traditional medicine. Next slide, please. So learning from the shortcomings of traditional medicine and the catch-up it must do to improve women's health, lifestyle medicine is strategically placed to improve women's health globally faster, smarter, and better. There is enough evidence to substantiate that nutritional foods have a high potential for countering anemia, osteoporosis, pregnancy-related complications, and even infertility in women. Evidence clearly exists. That's the beauty of lifestyle medicine, right? It's an evidence-proven science. Evidence continues to accumulate. Aerobic exercises, strength training, and flexibility exercises can improve women's cardiovascular health and menopausal symptoms. They reduce breast cancer risk and promote overall well-being. Similarly, healthy sleeping practices have profound positive effects on women, lowering their risk of hypertension, type 2 diabetes, and cardiovascular diseases. Next slide, please. You also know that substance use in women can lead to problems with fertility, pregnancy, menstruation, breastfeeding, and menopause. Here again, lifestyle medicine can bring greater returns over a women's life cycle. Self-care, practicing mindfulness, and engaging in stress-relieving activities not only improve mental and emotional well-being, but can also help address fertility issues, gastrointestinal distress, heart problems, and obesity in women. Again, clear evidence exists to this effect. There's in fact a series that was actually put up by the American Journal of Lifestyle Medicine on women and lifestyle medicine. I think it came out in 2019, 2020. It would also encourage you to look at the series in which all the collation of evidence for these statements exist. Finally, social connectivity provides a sense of belonging, profoundly benefiting women's mental health and well-being. Next one. So this is a figure from the Lancet I just pulled out to show that the risk factors for cardiovascular disease in women, but generally non-communicable diseases as a whole, we can categorize the risk factors into 3 broad categories. And these 3 categories are those that are well established. And these risk factors affect both sexes, men and women, but even though they can manifest slightly differently. So hypertension, your dyslipidemia or high cholesterol and diabetes are some examples of those well-established risk factors common for both men and women. The second group of risk factors, those that are very sex-specific, these are exclusive for women, such as premature menopause, pregnancy-related disorders, such as gestational diabetes or pregnancy-induced hypertension. So these are very specific to the female sex. And those that are under-recognized. And these are, issues such as intimate partner violence, domestic violence, sexual harassment, or poverty as a driver. And as I explained to you, the feminization of poverty as a phenomenon. These are under-recognized factors also contributing to chronic diseases and non-communicable diseases. There is an interaction between gender and women's social and physical environment. So they together kind of make the environment conducive for the manifestation of chronic disease or non-communicable diseases. Although research is beginning to recognize how these factors might interact or increase risk, first of all, acknowledging the effects of these well-established, sex-specific and under-recognized risk factors is crucial to understanding women's health and how lifestyle medicine can make a long-lasting impact in women. Next one. We want to touch upon this phenomenon of life course epidemiology. See, life course epidemiology and lifestyle medicine are closely interlinked. So life course epidemiology studies are contribution of biological and social factors acting independently, interactively, and cumulatively during different times of your life cycle, which includes even in gestation, infancy, childhood, adolescence, and during adult life, and the impact of these factors on health outcomes in later life. The emphasis on the adult lifestyle as the cause of chronic disease is being increasingly challenged by life course research. So to say that in your 40s and 50s, you have to make sure that you take up all healthy lifestyles is already a bit too late. So lifestyle medicine needs to start working very early on in your life. And as I said, it's not just even after the baby is born, but even during gestation. So it actually starts much before to have an impact on your later half of life. So the source of risk lie much earlier in life or even in previous generations. Next one, please. In addition to the proven role in preventing and reversing chronic disease and promoting healthy aging, lifestyle medicine plays an outsized role in reproductive health, as the impact on women in the months to years before pregnancy affects not only maternal health, but also health of their children throughout their lifespan. The impact of maternal lifestyle during early pregnancy can affect the developing fetus through various fundamental biological processes referred to as epigenetic imprinting. The maternal epigenetic imprinting can also affect the fetal ovarian cells, not just the fetus, but if it's a female fetus, it affects the ovarian cells of the fetus, which means the impact can be had even on the future grandchildren. So what is in terms of healthy lifestyle before pregnancy and during pregnancy, not only has an impact on the mother, the baby, in fact, even the grandchild potentially. So it actually has an impact on generations. But changing lifestyles are also negatively affecting the reproductive capacity of the population. So the birth rate is on the decline for many reasons, but also there are medical reasons. So what we refer to as a subfecundity is on the rise, secondary to both ovulatory infertility as well as declining sperm quality. So pregnancy outcomes, maternal morbidity, and mortality are also affected. So lifestyle medicine for women has the potential to make not only a public health impact, but also a demographic impact. Next one, please. Growing evidence actually suggests, next slide, Mariam. So growing evidence suggests that our food choices, exercise, stress, sleep, and stress management, social connectedness, and environmental exposures all contribute to a healthy glow from the inside out. So skin health can be promoted by lifestyle medicine, evidence proven. And what is assertive about the role of lifestyle medicine in dermatology and skin health is that when we optimize evidence-based factors that help keep the skin clear and skin disease burden is reduced, we also positively impact the overall well-being. The confidence of the person increases, has an impact on cardiometabolic health, their cognitive and emotional health, and overall well-being. Breast cancer survivors have unique medical and psychosocial issues that must be addressed as part of survivorship care. Critical areas of breast cancer survivorship care, including monitoring for disease recurrence, screening for second primary cancers, addressing medical and psychological consequences of treatment, and counseling on health promotion. There is increasing data that demonstrates the importance of lifestyle interventions, which may decrease the risk of recurrence, improve quality of life, and ultimately improve outcomes after a diagnosis of breast cancer. So breast cancer survivorship and what happens after a breast cancer treatment, again, lifestyle medicine has a big impact. And last but not least, the dietary patterns, including some specific dietary components, are linked to sexual health with vascular and other mechanisms at play. See, healthy pelvic and genital tissue vasculature is needed for the female peripheral vascular system. Many women experience sexual health concerns or dysfunction, many of which is closely related to lifestyle factors. Providers have an opportunity to engage patients in healthy lifestyle behaviors in the context of conversations that they can have about improving sexual health and satisfaction, ultimately contributing a spectrum of benefits for both sexual health as well as the overall well-being. Next one. 6 evidence-based strategies can be deployed in the process of engendering lifestyle medicine. See, one, through engaging campaigns in schools, workplaces, and communities, girls and women can be empowered with knowledge about lifestyle medicine, its benefits, and its practical implementation. Healthcare services need to be affordable, and universal health coverage, including insurance packages, should include access to preventive screenings and lifestyle counseling. In-person and online communities should be developed to foster support, provide guidance, and share resources for sustaining lifestyle changes among women and girls. Next one. While designing physical activity promotion strategies, it is essential to recognize that women face cultural and religious barriers in accessing physical fitness facilities. So the design of spaces for physical activity should consider the specific needs of women and girls. And this is an advocacy that we have to put forward to governments to make sure that when physical activity promotion is designed, or when programs are launched, the unique needs of women and girls are catered for. Interestingly, OBGYNs, midwives, and nurses need training in lifestyle medicine, as they encounter women and girls more often than primary care physicians and other specialists. Leadership and governance is crucial. See, again, the American College of Lifestyle Medicine has developed a women's health member interest group, and they convene and discuss advancing women's health, lifestyle medicine, education, and practice. A model that you could also think about to have a subgroup to focus more on lifestyle medicine for women and girls in Mexico. Next slide, please. Reducing the burden of cardiovascular disease in women by 2030 is an ambitious target, but an imperative and a worthy one. Mainly because despite the heterogeneous patterns of disease and risk factors across countries and contexts, with intervention, much of the risk can be modified and mitigated. The next decade will be pivotal for clinical science, lifestyle medicine, and public health, as there are substantial economic benefits to reap. Again, make reference to the McKinsey report I opened when I opened the meeting. So the excerpts that I drew from the McKinsey report actually gives some explicit information and based on very robust economic analysis. Addressing the women's health gap could boost the global economy by adding at least $1 trillion by 2040 annually. This means a 1.7% increase in women's average per capita GDP. On a global level, effective treatment of 10 conditions, for example, premenstrual syndrome, depressive symptoms, and migraines, could make up more than 50% of the economic impact. And lifestyle medicine has already been proven to make a difference in these health conditions. And if you really look at menopause as a health condition itself and the various issues that surround menopause, that itself is also a very significant contributor in terms of the gains that lifestyle medicine can bring from an economy perspective. Next one. In their recently published systematic review and meta-analysis in the American Journal of Preventive Medicine, Carla I. Galavis and team concluded that though several pharmacological approaches can reverse pre-diabetes, lifestyle modification provides the most robust evidence of effectiveness and should remain the recommended approach to address this condition. And similarly, in a meta-review of lifestyle psychiatry, the role of exercise, smoking, diet, and sleep in the prevention and treatment of mental disorders, Joseph Firth et al. Found substantial evidence from multiple meta-analysis of longitudinal data and Mendelian randomization studies that physical activity has a protective role in reducing risk for certain mental disorders. Post-hoc analysis of longitudinal data from 40 clinical centers throughout the United States, included in the Women's Health Initiative observational study, found that higher adherence to a Mediterranean diet is associated with a low risk of hip fractures. These results support that a healthy dietary pattern may play a role in maintaining bone health in postmenopausal women. Next slide. And this is my last slide. See, over the last several centuries, economic progress has allowed millions of women to move from rural subsistence agriculture to urban, more economically prosperous lifestyles. This trend is set to continue, even accelerate in the next century. Due to changes in diet, activity, and lifestyle, non-communicable diseases such as cancer and heart disease will continue to rise for women globally. We are uniquely positioned to anticipate the impact and empower women in both the developed and the developing world to learn from what has worked. Choosing the best approaches to nutrition, exercise, sleep, connectedness, substances, and stress can optimize women's health span across the globe. Women of the world deserve nothing less. The time to engender lifestyle medicine is now. And hopefully, this conversation will kickstart your thinking and your commitment towards advancing women's health through a lifestyle medicine approach. So I stop here and I end my presentation, and back to you, Mariana and Sari, and I'm happy to take any questions.
Thank you so much, Dr. Sathya. Such an interesting presentations. Thanks for your time and thanks for sharing. And yes, we would love to move to the questions. So I will speak in Spanish for the people to understand. Gracias a todos por estar aquí. El doctor Sathya dejó un espacio para sus preguntas. Si alguno quiere hacer alguna pregunta en español, Mariana y yo vamos a estar haciendo una traducción simultánea para que el doctor entienda y les pueda contestar. Lo pueden escribir en el chat, y si alguno se quiere lanzar, levantar la mano y abrir su cámara y preguntar directamente en inglés, también siéntanse completamente libres.
So, well, I'm gonna be the first one here to
Break the ice.
Yes. So I really love this topic. I think it's very important to give voice to women's health, and we know this is more, or can be more, like an issue of public health, a public health issue. But what strategies do you think are important to start implementing more in like a private practice? What strategies do you think it can be helpful for a physician, a nutritionist that are more like in a private practice setting?
Right. In a private practice setting, again, the approach that we often take is, seeing every patient similarly. So the intake form often that we have as lifestyle practitioners, right, could be the same that we use for all patients. And we've not even kind of done any kind of research to see which works better in women. So, but first of all, I think that there's a bigger call for the associations, the medical associations, and the associations of various lifestyle medicine practitioners to see women differently, and then to even see what kind of tools work better in women. But, it has to be customized to the local context. But while the research is going on, there are some global good practices that are available. The starting point could be really in terms of the intake forms could be customized differently for women. And the way that we actually prescribe, and because lifestyle medicine promotes prescription of your nutrition as well as your physical activity, including all the components, right? So the prescription again could be customized to the women and their specific and the unique needs of women. So rather than have one blanket approach for everyone, it needs to be customized to understand the unique needs of women. So from a private practice point of view, I would really I would request the private practitioners to spend more time with the women and to be able to first start with the aspect of clearly understanding the problem, taking more time and to kind of get the questions in such a way that you're able to have a comprehensive understanding of the women. And then because the problem with the traditional medicine, as I said, is that they tend to ignore women's symptoms. It tends to have a gender bias in the way it is. So it dismisses what the women says. So, but the lifestyle medicine practitioners have to give due attention and focus in terms of first getting the diagnosis right? For that, you need a good comprehensive history. And secondly, leading the diagnosis should be backed by good treatment modalities, which are similar or in fact even better for women based on their needs. So just make sure that what the traditional medicine has failed to do, make sure that in lifestyle medicine, do not do that. So make sure that there is proper evidence. That's the research I'm calling for. And at a private practice level, make sure that there is a thorough diagnosis. Make sure that there is a thorough treatment. So that's basically what I would have as an advice for practitioners.
Thank you so much for your answer. So we have a question from Maria Miron.
Right.
In English. I'm going to read it for you.
Yep.
It says, thank you, Dr. Doraiswamy, for such a clear and interesting presentation. I'm sorry if my pronunciation of your last name
That's
was...
okay.
She says, as a clinical psychologist, I'm particularly interested in the meta-analysis you mentioned on lifestyle interventions for psychopathology. Could you please share the paper or the authors with us?
Yeah, absolutely. So as I said, it's Joseph Firth et al. And this is titled The Lifestyle Psychiatry. But immediately after the meeting, I'm happy to share it with you, Mariana. I have your email. And if you can actually circulate it to everyone who was interested, happy to do so. Okay. In fact, I will also send you those publications around lifestyle medicine and women's health, those that I kind of access from the American College of Lifestyle Medicine. I'm happy to send it to you for forward sharing.
Thank you so much. Of course. Okay. Claudia Juarez is raising her hand. Go, Claudia.
Hi, thank you so much for this presentation. I would like to ask, what do you think is the main reason that women suffer more diseases than men? It is because the lack of gender orientation in medicine, or maybe because we are exposed to, my assumption is we are exposed to environmental toxins and we are more affected than men.
Yeah, absolutely. So from you, I think in your question, a lot of answers were already built in. But I think the core issue is, as I said, is the fact that women's health has been ignored by traditional medicine. And that's why systematically, the fact that they are under-researched itself is a starting point. So we do not understand women as much as we understand men in terms of the conditions that they go through. So anything that has not been researched, that has not been understood, obviously is not going to get the attention. And again, the healthcare providers tend to have a bias from a gender perspective. And that's because it's often the symptoms that people think is related to the hormonal aspects. How many times they say, oh, this is the menstrual period, or this is the premenstrual period, and that's why they behave in this way. This is a symptom associated with that pain. So the woman's body is poorly understood, and the inherent gender bias tends to ignore the actual symptoms and the problems that women face. So that's why under-researched, under-diagnosed, under-treated. And that's all because the science has not fully understood that there is a molecular difference. In the guise of protecting women, it's actually done more harm by not including them in the overall mainstream thinking. So the answer is the fact that the prevailing gender inequality and the fact that women have not received the right status in the society also reflects in medicine. And that needs to change. It's changing, but it needs to change more quickly. One of the estimates from the UN Women said that it takes another 300 years for us to achieve gender equality globally. So it's how far women have been left behind in many parts of the world.
Yeah. My last book I wrote about this topic because I think it's important.
Absolutely. Absolutely. Because, again, looking at that Lancet figure of the different risk factors, right? So the factors that are the general risk factors are known, but the sex-specific risk factors and the under-recognized risk factors, the impact of domestic violence, the harassment and the emotional abuses that women face in multiple settings are all ignored. Because all of these come together to have an impact on the overall health status. And this is directly linked to the non-communicable disease burden.
Totally. Thank you.
Yeah.
So anyone else? Okay, so Claudia Dorantes is in the chat. Thank you so much for taking the time to speak about women. I love the approach about the importance of women's health and how it impacts, how it has an effect on next generations.
Yes. Absolutely. And that's how, it's so important. And we need to be advocating for it at all levels. So we need good arguments. So basically, if this presentation, and feel free to share with everyone, Mariana, the presentation. So if you're able to draw a few messages from this, and when you speak to policymakers and decision makers, so you would be able to use these arguments. Because as I said, we need education, we need research, and you also need advocacy. So we teach the future generation, the students, we continue to invest in different forms of research, but we also advocate to the policymakers to make sure that these are included.
Of course. And I also think this is like part of the basic competencies of lifestyle medicine practitioners to see the patient as the person as a whole, not just like the disease, right? And see, with this approach of as a whole, it is like really important to make differences between the needs of women and the needs of men, and each has different kind of needs in health, no? So yeah,
yes,
I think
absolutely.
it's part of the basic competencies.
Absolutely. And it's quite interesting that you have a number of women, right? So even in this, the participants in this meeting are mostly women, as I see the names. So again, you are the champions. So you have to take it on yourself to take it forward. And social media gives you a good opportunity because online communities and empowering women and girls. Again, lifestyle medicine should not remain as something for the rich. So it is the poorer societies and the poor communities who are also heavily affected by the lifestyle choices that they are forced to make, right? Unfortunately, many of the non-nutritious, high calorific foods often come at a lower cost. So they are much cheaper than nutritious foods in many instances. And that's why you see a lot of obesity, even in the populations that are poorer. So it is not that they are only undernourished. You also see very high non-communicable disease. So how are we going to take this to scale? How are we going to reach the poorer society who may not have access to this knowledge and information? I think that's what we should be thinking about, as much as just it's our communities which have access to knowledge and information.
Totally. Yes.
Yeah. Very good.
Thank you.
Sure.
So if we don't have any more questions, we can close.
Yes, I'm very, very glad to have had this opportunity to come and interact with you and share some ideas and thoughts. So yeah, if I can support you, help you in any way in your endeavors, please feel free to let me know. But as promised, I will send you a set of resource material that you can share with everyone. And yeah, encourage you to continue to be updated because lifestyle medicine is a growing field and new evidence continues to come in. right? So what I presented were probably from a year or two ago. But in this year, if you do a quick search in PubMed, there are also new materials that come in. So keep updating yourself, because evidence-based advocacy is the best. And that's how lifestyle medicine positions itself, providing a strong evidence base when compared to other forms of medicine, such as complementary medicine, where the research base and the evidence base is still weak. So all the very best in your endeavor. So wishing you all well, and
Thank you so
hope to
much.
be in touch.
Thank
Thank
you
you
so
so
much.
much, Sathya. Good night.
It was
Good night.
such a